a huge army of neurosurgeons who care about this global neurosurgery concept. And I feel more optimistic than I have in my entire career, which has been pretty optimistic in itself, about where we are going and about the potential for us as a discipline to really be able to make a difference in the world. Well, it's my last talk in what's been a really wonderful uh, series of meetings and mainly series of conversations with all of you. I would like to once again thank our hosts for a remarkable organization of these two meetings, the Pakistan Neurosurgical Society and the ICRAN meeting. Really extraordinary organization and hospitality and state-of-the-art presentations. So just in the last few minutes to kind of summarize some thoughts about global surgery and global neurosurgery, one could say, why all this talk about neurosurgery? We're this year celebrating our 100th year as a discipline. I'll remind you that it was in 1919 that William Mayo stood up at a meeting after Harvey Cushing presented his series of brain tumors and said, "Gentlemen," and it was all gentlemen then, "Gentlemen, I believe we have just witnessed the birth of a new specialty called neurological surgery." And from the beginning, there were international members of those groups, and neurosurgery has always been global. And if you just look at our own history, it's a proud and rich history. And I've put up just the flags of some of the people who've been major contributors to our discipline over these last 100 years. And as you can see, they come from everywhere, from every continent, and from every nation. And so we've always been global. So one could say, well, what's all this talk about global just in the last 4 years? Well, part of it is, and probably most of the new resurgence in global surgery has to do with what's been going on at WHO, because we're increasingly recognizing as neurosurgeons that we have to be involved in the decision-making bodies for global healthcare if we're going to be able to make a difference for our patients. So as you know, it all started with this. It was having a physician, Jim Kim, who became the first doctor ever to be appointed the president of the World Bank. And lest we ever fall into the dispirited thought process that says one person can't make a difference, here's an example of someone making a difference. When you have a doctor who is now running the World Bank, who's an internist, not a surgeon, but who, with his partner Paul Farmer, had coined the term the neglected surgical patient, and recognized from the beginning of his time as a medical student that surgery was an indivisible part of the public health. That's why we're here today. So one person can make a difference. And so you know about the Lancet Commission, and I'm so glad we all do. And we can go forward now together on the basis of, I think most neurosurgeons know about how that really has encouraged us and animated our community. So we're scaling up. We've had this change in culture. We've had global leadership, involvement in policy, and these are just some things that I'm going to very quickly go through in the next few minutes, just to summarize where we are. We've talked about this. I've already talked about it once today, and I think it's resonating with the leaders in this room and beyond, and that is that we do have a greater responsibility than just to those patients in front of us, that we need to use our knowledge, experience, our position in every society where neurosurgeons exist to advocate for high quality neurosurgical care for everyone, everywhere. And this photo taken at Roger Hartle's place, where they called together the first global symposium not so long ago, just within the last year and a half. And it made a big difference in bringing people together, neurosurgeons together, to share best practices together, and then to bring them back what they had learned to their own parts of the world. So There's been global leadership on every continent. These are just a few of the people from Malaga to Serbia to Romania to Toronto, and every place where we practice neurosurgery. This message has been heard, and wise and humanitarian academic and private practice neurosurgeons are carrying the ball forward. In my own country of the United States, we've been fortunate to have had leaders who have run our scientific programs and have been our presidents who've had this kind of vision. And I would invite you now to the next AANS meeting under the leadership of Chris Shaffrey. His theme is the world of neurosurgery, and it's the focus that he's bringing to the meeting in April in Boston is, again, all about global neurosurgery. And so I'm very pleased that so many people in neurosurgery, again, from every continent, have been willing to become part of this very important week that happens every year at in Geneva at the World Health Assembly. And so year after year, these last 3 years, we've had neurosurgical leaders who on their own time and on their own nickel come to Geneva and help advocate on behalf of all of us and our patients. And here's just some of them participating in this year's meeting: becoming involved in policy, the ICD 9, 10, and now coming out 11 codes that you know and use in all your hospitals. Without this committee and without the involvement of these neurosurgeons, we wouldn't have neurosurgical input into how we as a world community assess our global burden of disease. We're very involved in helping the WHO member nations learn how to develop their national surgical, obstetric, and anesthesia plans. And as you've already heard, Pakistan is the leading light among neurosurgeons in doing this effort. I encourage all of you to get to know the Minister of Health of your country or someone in that office, because we need to have that relationship in order to be effective on the global stage. This you'll be hearing more about this afternoon. These are the WFNS Peshwar recommendations. What it is a group of over 50 neurosurgical associations and key thought leaders who came together to produce a document, which you'll be hearing about at 1:45 this afternoon, which is designed to make it easy for the member nations who are developing their NSOAPs to use this as a template that is neurosurgically driven and written. So we're very happy about the opportunity to help these member nations with a national plan for neurosurgical care, pre-hospital, hospital, and rehabilitation care that was written by neurosurgeons using evidence-based and consensus to derive it. And we're quite excited about the rollout of that this afternoon at 1:45. You've already heard and seen about the major effort in publications, and you're seeing the effect of that in all of our journals. And what I'm most pleased about is that those who have never published before are now publishing, and that's where most of our cases are occurring, not only neurotrauma, but as our previous speaker pointed out, in neuro-oncology. So if there's anyone in the room who has not signed up yet for the GNOS study, this global neurosurgery outcome study, their recruiting is through December 31st. There's an opportunity to be an author if you just collect 1 month of cranial surgery operative data at your institution. So I hope there's no one in the room who's not involved. It's a great opportunity to become an author on a very important paper that will give a snapshot to what is going on currently in our world today and how we actually treat cranial trauma. If you don't know how to do it, it's listed here. Come see me. I'll help you get involved. You've all seen this. Some of you may not yet have heard about this great new site that has been developed. It's a web application called Intersurgeon, developed by neurosurgeons William Harkness and James Johnston, but it now has expanded from being a matching site for those who have needs and those who have resources in pediatric neurosurgery. Then it expanded to adult neurosurgery. Now it's including NGOs and multiple other surgical disciplines. So it's a way of organizing the world of people who have resources and want to be of help in teaching in LMIC, and those who are elsewhere and are able to identify through this mechanism what kinds of resources they would benefit from partnering with. So it's a great site, and I hope that you will find it as useful as I do. Another useful organization is FIENS, the Foundation for International Education in Neurosurgery, which acts as a clearinghouse of useful global neurosurgical information and also helps those who are interested in setting up these very successful twinning partnerships between universities or private practices that we've been talking about. Another photo of the Cornell group and sharing of best practices at their global symposium. And then here's a remarkable contribution by Jim Rutkahan and his team at the University of Toronto, who have actually designed an entire tenure track to full professorship in global neurosurgery. So just like one can follow an academic track in skull-based surgery or spine or cerebrovascular, now you can do that at Toronto in all the surgical disciplines, not just neurosurgery, in global surgical surgery. They've posted this on their website, and if you're interested or in a leadership position and would like to do it at your university, they've outlined what gets you to be a full professor at Toronto, and I think there's all things we can learn from following that template. So as I conclude, there are opportunities for new leaders to emerge clinically through simulation, and we're already doing some of that, but we need to do more. There are these are the kinds of things that we are collecting now. I just show you the areas of collaboration that we're trying to get a handle on. There's so much good work being done by so many humanitarian and academically inclined neurosurgeons, but we're trying to coordinate those efforts so that we can go farther, faster together. So we're on every continent and in every nation trying to look at what are the global partnerships that are being done in academic practices, in professional organizations, governmental organizations, faith-based, and even those ethical and responsible industry-based collaborations. So you know these numbers. I'm glad that we all do, because they're a challenge that we all have, but we have the capacity to deal with it. We need to continue to remember that we don't operate in a vacuum, and that we need to work with the other so-called SOTA specialties, surgery, obstetrics, trauma, and anesthesia, through organizations like the G4 Alliance, which is the major partnership of 80 plus organizations, such as the World Association of Societies of Anesthesia, the World Federation of Neurosurgical Societies, and all. That's the organization that comes together and then lobbies with the UN and the World Health Assembly in order to move the ball forward for all disciplines. And we also partner with non-communicable diseases as well. These are the next steps. You've heard some of that in our rollout of the Global Neurosurgery Committee that the WFNS has just formed. You'll hear more about that this afternoon as we present the Peshwar recommendations for collaborative treatment. I think we now are all agreeing that we have a responsibility to advocate for enhanced access to quality neurosurgery for everyone everywhere. And with that, I'd like to thank you very much for the great pleasure of being with you these days. Thank you.